My name is Esra Ege. I am the founder of Children's Heart Surgery, and since 2010 we are offering Turkish medical services for pediatric cardiac patients, for neurosurgery patients, for uro-oncology patients, and we have evaluated more than 1,000 patient files, and also we have treated over 500 patients in Istanbul. While we are having a patient mail, having the reports, we are contacting the first doctor who can serve the patient with the best medical service and taking the opinion of the doctor and mainly the medical team. And after that, creating the cost of the operation or the treatment that has been advised by the medical team. We are sending the evaluation of the patient generally within maximum 48 hours, and we are also responding the questions which are disturbing the patient. After that, if the patient decides to come, then we are preparing the visa invitation letter if the patient is coming from a country who needs a visa for Turkey. We are sending the pro forma letter and also the visa letter so that the family or the patient can apply for the visa, and all the Turkish consulates are giving very speed visa services, especially for the patients who are going to be treated in Turkey. When the patient arrives to the airport, there is a team who is welcoming and taking the patient and the family to the hospital, to the hotel directly. Generally, the second day in the hospital, also a translator is giving full service to the patient who is making the analysis, blood tests, or echographies, or MRs, or all the related issues before operation. While there is also special dedicated nurses, especially for the cardiac operations. Before the operation, the medical team gives a one-to-one explanation to the patient, giving a full detail of what is going to be done and what is the outcome is expected and the success rate. So the patient has a direct contact also with the doctor, and language is not a barrier because the translator helps the patient in each step. After the operation, there is the post-op process, which is there is up-to-date intensive care units at the hospitals, and also there are dedicated intensivists who are serving the intensive care unit patients. After the post-op, when the patient comes to the room, all the treatment that is going to be done after returning to the country is also fully explained by the medical team to the patient. And when the patient is discharged, also it's a team who is following directly to the airport so that the patient doesn't have a problem in arriving to the airport. So, as a matter of fact, we are trying to help in all the steps of the medical treatment to the patient who is choosing Turkey hospitals as a treatment center. Hope we are doing the best service to our patients, and we would like to continue in the near future for serving patients with Turkish medical services.